Hello and welcome, and thank you for attending today's webinar, Overcoming the IT Security Challenges Facing Healthcare, sponsored by Unisys. I'm Stuart Corner and I'll be your moderator. I'm a long-time writer and commentator on IT with a focus these days on the myriad issues created by the Internet of Things. But as you'll hear, the challenges facing health IT systems are enormous. Health IT systems are a priority target for cyber criminals, because the value of medical information on the black market is 10 to 20 times that of other personal or financial information. Our speakers today are eminently qualified to examine these challenges. First up is Jeff Livingstone. He's the Vice President and Global Leader for Life Sciences and Healthcare at Unisys. He's a life sciences, healthcare and cybersecurity professional with over 30 years' experience. Jeff will be followed by Bou Leong Lai, Unisys Healthcare Solutions Director for APAC. He also has more than 30 years' experience in medical devices, clinical services, pharmaceuticals and healthcare, gained through senior roles in leading healthcare organizations. At the end of their presentations, I'll be putting some questions to them. So with that, I'll hand it over to Jeff to begin our webinar.
Thank you, Stuart. Eddie, the people listening to the presentation that have been following Unisys for the past couple of years know that we have been on a very deliberate security footing. And one of the themes that resonates throughout our company is security in everything we do. And in particular, when we were setting up our first verticals, particularly life science and healthcare, we realized just how important security was to that industry and, quite frankly, just how far back that industry was in terms of not just technology adoption, but specifically security adoption. So what Bou is going to showcase today is some of the findings of our work and study over the past year and some of the things we think this industry should be keeping its sights on and be mindful of. And without further ado, I'll turn it over to Bou. Thank you.
Thank you, Jeff. Good day all. Welcome to this webinar on the security challenges facing healthcare today and steps you can take to overcome them. My name is Bou Leong, and first off, let me walk you through briefly how I have structured the presentation. I will begin with sharing some insights on security from a global perspective, then zoom in specifically on healthcare, and later dwell deeper into the vulnerabilities that exist in medical devices. Finally, I would like to share with you steps you can take to mitigate these vulnerabilities and exposure to potential risks to your organization. The attitudes of consumers around the world are dramatically changing, and at the same time, their anxiety over security is dramatically increasing. In 2007, Unisys Corporation launched the Unisys Security Index, the only recurring snapshot of security concerns conducted globally to provide an ongoing, statistically robust measure of concern about security. The index is a calculated score out of 300 that measures consumer attitudes over time across 8 areas of security in 4 categories. The 2017 Unisys Security Index stands at 173, which is 20% higher than in 2014 and is at its highest level since its inception 10 years ago. Global consumer security concerns are high and rising, with identity theft and bank card fraud topping the list. And while security worries have traditionally been higher in developing countries, concern is rising fastest in developed countries, thus closing the gap between the two. In Australia, the security index stands at 157. On top of The concerns among Australians is identity theft. 58% of Aussies are concerned about unauthorized access to or misuse of their personal information. Young people aged 18 to 24 years are the most concerned. It has an index of 173 above the national average of 157. As mentioned earlier, developed countries such as Australia shows the biggest increase. For Australia, the index grew 51% from 4 years ago. The next infographic shows how a growing threat cybersecurity concern is in healthcare. Gemalto, a leading provider of digital security solutions, collects extensive publicly available information on data breaches around the globe. This information is then aggregated into the Breach Level Index, which is a database of worldwide data breaches. The report analyzes the data in terms of the number of breaches, the number of data records lost or stolen, and data breaches by the source of breach, the type of breach, and by industry. As you can see, for healthcare, compromised accounts grew 27.4%. Overall, healthcare organizations encountered the greatest numbers of breaches among all other industries in 2017, and this is a trend which has been observed for the past several years. IDC Health Insights predicts that the situation surrounding ransomware will get worse before it gets better, with the incidence of ransomware doubling in 2018 compared to 2016, as cyber criminals get more brazen and their attacks get more sophisticated. The impact on IT from this observation would be that mission-critical clinical systems are not available when IT systems are taken offline for remediation, creating patient safety issues and resulting in lost revenue opportunities when patients are diverted to other institutions. Constantly evolving and more sophisticated cyber attacks will tax an already overburdened IT staff. An IT system may be held hostage by cyber criminals demanding exorbitant ransom payments. According to Forrester's Global Business Technographics survey, companies in the healthcare industry and public sector only spend 15% of their total IT budget on security, lagging behind every other industry. Interviews with healthcare security professionals confirm how far behind they are. Most of them attempt to isolate vulnerable devices on virtual LANs, but acknowledge that the system remains flat, with their connected devices potentially exposed to the outside WAN. Most healthcare IT departments lack resources to pen test connected devices before their deployment. Medical device manufacturers and regulators make it challenging or impossible in some cases for security professionals to directly patch or implement endpoint security controls for these devices. And Australia is not excluded from this global trend. Late last month, Australians woke up to the troubling revelations that their private healthcare information, such as their medical conditions or the treatments they underwent, could have been compromised. A new mandatory notification scheme that requires businesses to report to the Office of the Australian Information Commissioner, the OAIC, when there is such a data breach, shows that in the first 37 days of the new regime, a data breach occurred every 2 days in the health sector in Australia. Medical devices represent a weak spot in the healthcare providers' cyber defenses. Healthcare providers, CIOs, should protect their patients and their organizations by understanding the specific vulnerabilities and create the necessary strategies and action plans to minimize the risk. If we look at medical devices problem in the past, since the advent of electronics-based medical devices more than 30 years ago, there have been accidents and incidents in which medical devices have caused harm to patients. Some of these events occurred due to misuse of the devices, and some were caused by manufacturing faults. The known events are well documented and highlight how the introduction of new technology brings risks. Over time, this set of very complex systems has matured, and medical devices today rarely have such failures, delivering too much radiation to a cancer patient, for example, or killing the wearer of an implanted cardiac defibrillator due to short circuiting. Looking forward, a new type of risk has surfaced that requires the healthcare providers, CIOs, more direct attention: the cybersecurity risk. This risk arises from the use of integrated computational devices that host the medical device control programming, and from the use of network connectivity to communicate data. Medical devices have become computing devices, and when deployed on open networks within the healthcare provider enterprise, they are vulnerable to the same cybersecurity risks as most other IT resources inside the organization. Medical devices have been used as entry points for several highly publicized cybersecurity events recently. Compounding the problem is that your perimeter is changing. We are progressively harnessing the functionality of the cloud for our data and our processes, and concurrently there is increase in the use of wearables, sensors and tablets for communication and for data retrieval. We are in the process of rolling out a remote patient monitoring solution, giving caretakers of homebound patients reliant on pulse oximeters, respirators and the likes the ability to not to have to sit by the bedside, but rather be notified by smartphone not only of alerts, but of changes that might lead to alerts. These devices have to be connected, and without proper security, they even are more vulnerable as devices in the hospital, often without benefit of even rudimentary firewalls. Earlier in October 2016, Johnson & Johnson warned over 100,000 patients who were using its Animas One-Touch Pink insulin pump that a hacker could exploit a vulnerability to overdose diabetic patients with insulin. The Animas One-Touch Pink was sold with a wireless remote control that patients can use to order the pump to dose insulin. Several vulnerabilities exist in medical devices cybersecurity. In the area of network access, it is better that devices are isolated to specific area or specific department within the hospital and do not connect to the enterprise network. Organizations can consider micro-segmentation approach to provide this segmentation. In area of security patching, many medical devices in use are mobile and sometimes implanted, which makes them difficult to maintain or to update. Today, there are still providers running versions of DOS and Windows NT and Windows XP. Lastly, medical device security needs to stretch beyond traditional security efforts. Within the population of medical devices, that level of control will be different and require a more sophisticated approach, leveraging newer risk mitigation capabilities than in the past. Exploits could result in compromise of protected health information. Ransomware encrypts files, preventing caregivers from using systems to provide care until a ransom is paid or systems are cleaned and restored. In a denial of access or denial of service attacks, cyber attackers flood the network with packets, preventing the flow of normal traffic and resulting in poor system performance or no access at all to critical systems. Malware and viruses installed on systems using common operating systems that allow bad actors to access protected IT resources. This could result in the compromise of protected health information or lead to a ransomware attack. Lastly, impersonation of devices, where a device enters the network and behaves like an authorized device, but watches network traffic and collects data. This could result in a compromise of PHI or deeper unauthorized access to protected systems. Now let me share some common security pitfalls that we have seen. The use of hard-coded administrative passwords. These default passwords are used to permit privileged access to devices such as service technicians. Discovering these passwords is easy because the same password is often used in a code of multiple devices. Next, it is common for medical devices to interface with web services that provide a graphical interface for configuring and interacting with the device. And these are often unencrypted. Thirdly, medical devices that don't require the login credentials of pre-authorized users are highly vulnerable to cyber attacks. Internet of Things allows cyber actors to access devices from remote locations, prevent connections to the device, or retrieve patient medication data. Lastly, the failure to scan application software for vulnerabilities. In the US, the FDA have taken note of the need to address medical devices' cybersecurity risks. Over the years, they have issued guidance and advisory for medical device manufacturers and healthcare facilities to take steps to ensure appropriate safeguards, and for manufacturers to remain vigilant about identifying risks and hazards associated with their medical devices, including risks related to cybersecurity. The guidance to hospitals and healthcare facilities is that they should evaluate their network security and protect their hospital system. In April 2018, just last month, FDA has announced plans for even stronger measures to address medical device cybersecurity in their document that was released entitled Medical Devices Safety Action Plan, Protecting Patients and Promoting Public Health. In Australia, the regulation of pharmaceuticals and medical devices are regulated by the Therapeutic Goods Administration, the TGA, which is an arm of the National Health Department. There is growing feedback and concerns that the TGA needs to step up as well to ensure that information provided by medical devices is safeguarded and that control of the devices implantable or otherwise is not compromised. These are our recommendations to address vulnerabilities. All healthcare organizations should require multi-factor authentication for all sensitive systems. We should quantify the sensitivity of all assets in our organization, define a strategy to handle all data based on this sensitivity, segment and secure the network, embed internal and external regulatory compliance protocols, encrypt all sensitive data. Businesses face a number of challenges, including optimizing operational efficiency, improving the customer experience, and reducing costs. More than ever, businesses require flexible, dynamic, and secure products and services to address these issues. Unisys understands the demands on our clients' businesses and the complexities of their respective markets. We have worked extensively to develop and deploy our suite of as-a-service, social, and mobile solutions to support their strategic initiative, providing our clients with a distinct business advantage, along with our key offerings, including security solutions, digital workplace solutions, digital transformation services, and advanced analytics. Unisys offers innovative, proven, and flexible capabilities for the entire security life cycle, from the prediction and prevention to the detection and remediation to ensure uninterrupted availability of critical services, systems, and data. At Unisys, security is built into everything that we do. Thank you for your kind attention. If there's any questions, feel free to email me at the contacts provided in this last slide. Thank you.
Okay, thank you, Bou. And I think Unisys is trying to say here is once again that looking at the types of transitions, the digital transformation that this industry, like many others, is undergoing, requires a big focus on some underlying first principles. And one of those first principles is definitely security. So rather than go out and sell independent security services or security products, we've taken a stance to essentially build it into all of our solutions, all of our assets, pretty much everything. And so that was one of the things that we will continue to do to combat this very large gap that we see in healthcare today. So with that wrap up, I'd like to turn it over to Stuart for Q&A.
Well, thank you, Jeff, and thank you, Bo. That was a fascinating presentation, and there's a whole range of important issues there. So it's brought up lots of questions. I guess the first one is, you mentioned that healthcare is a really popular target for hackers because the information is so valuable. Can you explain a bit why it is so valuable? I mean, if someone stole my financial information, they could clean me out, but I don't really see what they could do with anything about my health other than embarrass me somewhat.
Yeah, I'll take that one for the first time. So it's interesting because we have a pretty large security division that runs reports like the one that Bou showed here, and we do that not only for global threats but also for independent regions like the APAC region that Australia is part of, for example. And one of the things that we've definitely seen, and we do collect these through our federal connections as well as our other governments that we work for and do work for, is that there is a migration of hacktivism away from the classic credit card data and financial data and banking data and social security numbers and tax data and towards healthcare. And the reason why that is really for two big reasons. One, there's a lot of latency in the processes inside healthcare. I'll describe what I mean by that in a minute. And also, it's a laggard industry from a technological adoption standpoint. So when I talk about latency, particularly in very complex organizations like, say, the US and Europe, you have long times between transactions. Someone will go to a hospital, have something done, they'll get a bill a month later. During that time, anything could happen. So essentially, if you're a hacktivist and you've stolen information, you basically you have lots of time to do whatever you want with that data. It's not like someone's going to say, hey, you're hacked, and push a button on an app on your phone and turn off your credit card. That's not how it works. That's not possible today, right? So because you have so much time as a hacktivist, you have time to take that medical information and essentially build a independent persona, if you will. And that independent persona can be used in other systems to go out and purchase and make transactions and do everything. So you're given a great deal of power with the medical information that you do not get from the classic financial information. So to summarize, it's a latent, healthcare is a largely latent industry in terms of process, and it's a technological laggard. It is essentially a perfect place for the hacktivists to be focusing their time and attention.
Well, coming back to this issue of being a technological laggard, I mean, health in many ways is one of the most regulated industries. And though you mentioned that the FDA has taken some note of the need to address medical device cybersecurity risks, I would have thought that it was an area where government and regulators would be extremely proactive. What's happening in Australia? Is there anything underway in that regard, and do you think there should be?
I'll let Bou take that.
Yeah, we do anticipate that the TGA in Australia will follow suit after the recent FDA's additional measures. There have been growing concern about regulating this in a more tighter way, and industry stakeholders have already voiced their concern and provided feedback. So we do think that countries in Asia Pacific, including Australia, will follow suit with stricter controls and measures.
Anytime soon?
Yes, I believe so. Over the next 12 to 18 months, we can see similar framework and guidelines coming out from countries in Asia Pacific.
I would like to just add one point that we're seeing here, particularly in the western part of the world. There are two factors that will play into that timing. One is obviously the ability for the market itself to adopt. That's true, but at the same time, there's this question of who is responsible for security. For example, Bou talked about medical devices. Well, curiously, in a hospital, the networks and systems used to capture patient data are under the domain of IT, the IT function. They're the ones that are responsible for maintaining the networks, et cetera, as well as security. That's not true for medical devices. Medical devices in many large organizations sit under a facilities management entity, which is completely independent of IT. In fact, it's actually even budgeted independently. But still, even so, security is a common concern. It's a lingua franca, if you will, between different divisions. And it is the way to unify the different divisions to focus more on a timely remediation of many of these gaps. A third contributing factor also is that in many countries, medical devices cannot be modified once they've hit the market. Once you modify, if you decide to upgrade, up to date, it's been if you decide to upgrade the operating systems of these medical devices after they've hit the market, essentially you're violating the approval process. You're basically changing the machine. So now you have to go back through an entire regulatory approval process once again. So the legislation that Bou alluded to in the US, very recently, the FDA has started looking at allowing manufacturers to change specific parts of their operating systems such that they can implement, much like you do with, say, rollouts of PC operating systems, you can implement security upgrades and updates without having to go through another years-long approval process. If that comes to pass, then medical devices will be treated more like PCs, for example. And the only problem is that the PC is not making life or death decisions, or not collecting information upon which life and death decisions are going to be made. Therefore, there's going to be an entirely new regulatory body law that has to exist around medical devices and medical device patching, which doesn't exist yet today. So you can understand it's a thorny problem.
You said that healthcare provider CIOs need to understand the vulnerabilities of medical devices and create strategies and action plans to minimize the risk. But given that these devices are locked, can they do that to any great extent?
Yes, you can do. You don't have to necessarily work with the devices specifically to secure the devices. For example, in the Unisys Active Insights Med Device solution, we've actually embedded not just the security that we've discussed previously, but the stealth security into our solution. And very simply, stealth essentially blocks the ability for outsiders to see into the network and into the device. So essentially the device is, for all practical purposes, turned off and no one can see. So you can't hack what you can't see. There's the standard maxim, and that's true here. So if you can actually essentially turn off the devices so that they can't be seen, then essentially they can't be hacked. So that's instead of trying to force our way into the manufacturer operating systems up front, we instead decided to use our stealth technology to stealth shroud the medical devices and in addition the networks that they serve on, right, in this stealth cloud, such that they cannot be seen from the outside. So that is one way in which you can do. You don't necessarily have to modify the devices.
Talking to cybersecurity specialists about IT security in general, I've heard time and time again that security is something that starts at the top. It starts with the board and it has to permeate right to an organization. How do you think that might play out in like a hospital, for example, where you've got different bodies, you've got the clinicians, you've got nursing, you have specialists that come in that aren't really part of the organization as such. Do you think from an organizational point of view that healthcare and hospitals in particular could do more to increase cybersecurity?
I'll let Bou answer that.
Sorry, I couldn't hear Stuart very well.
I'm sorry, but I'll say it again. Talking to cybersecurity specialists about cybersecurity in other industries, I've heard time and again that security has to start from the top, from the board downwards, and permeate the whole organization. And I was wondering how that might apply for a large hospital, for example, where you have different bodies. You've got the nursing, you've got the clinicians, you've got specialists who just come in and do a job there and not actually part of the organization. How do you think this organizational approach to cybersecurity could be applied in something like a hospital?
I think it is correct to say that cybersecurity in a hospital environment is the responsibility of everyone, but it should begin with the leadership of the hospital with a policy, with a strategy to deal with cybersecurity, to establish processes and protocols, and to mitigate such cybersecurity concerns with using micro-segmentation, using role-based authentication and access control, and to deploy solutions to protect your assets, whether it is medical devices or other IT assets in the organization. So Jeff mentioned earlier about our stealth security solution, which can be deployed in medical devices as well as other non-medical assets. And what is important to note about our stealth security solution is that it is also open to devices that are using old operating system, and where devices are no longer supported by their original manufacturers. We offer solutions for the healthcare institutions to secure such legacy devices.
Mm.
If I may just add, I think, to be honest, there's going to be two pieces. I want to append what Bou said, because it's true. Inside the hospital, the leadership is going to have to take a stance. It's going to have to come from the top down. There will have to be, true actual education in cybersecurity inside hospital settings. That is definitely, if you speak to doctors and nurses that are the ones running around the floor, they do not receive this kind of training today. That is not, they receive healthcare training, patient handling, emergency handling, etc., but no cybersecurity. It's not there. It's not like in a standard industry, like, an office, for example, office environment. And it really needs to be. That's number one. Number two is that the bodies that regulate and oversee and come in and audit, these facilities, right? They should have a cybersecurity piece of that audit, which goes through and makes sure that there is at least a minimum standard, whatever that is, right, set by the government or associations that are evaluating such hospitals or such care facilities, right? That there should be some sort of basis upon which cybersecurity audits can be made. That doesn't happen either, right? And that does happen in other parts. So you can get audited for protection of patient information specifically, but you can't get audited for security specifically to some sort of ISO standard. I think that has to change. Well, I will say we think that has to change.
Hmm. That brings you to another question. Well, you mentioned that spending on IT security is relatively low in healthcare, and I thought that might be because the devices are locked, so there's not an option to spend a lot of money securing them. But it would seem that one area that money could be spent is in better training. How do you think spending in IT security in healthcare should change? Where should the money go if more money is to be spent?
I'll let Bou take that one too.
Yeah, I think the priorities of IT department in hospitals probably lies in acquiring IT assets and updating existing assets and software, but cybersecurity implementation is very low down the list of priorities. So while IT purchases and acquisitions may be there, but they are in the other areas and not necessarily in cybersecurity. One of the reasons could be that the awareness and the education is still not there. And over the last probably 1 to 2 years, we are seeing more and more of cyber attacks and of malicious intent being propagated in the internet, and in particular to the healthcare organizations.
Hmm. Well, obviously, WannaCry in particular had a really serious effect on the UK health system. I believe in part because a lot of the systems are running obsolete versions of Windows, and I believe I saw the other day a news item saying that there was some major initiative underway in the UK to upgrade all those old Windows operating systems. Do you think things like WannaCry are going to change the priorities for spending on IT in healthcare, and that security will get a significant boost?
I'll take that one. I think things like the WannaCry will make small changes. What will make seismic changes is the first time someone dies because of a hack that was done to, let's say, some sort of radiation instrument, or say a pump, a glucose pump, or something, or a pacemaker or something, where someone actually gets killed. If that happens, or I should say, when it happens, that's going to be that will cause a seismic response from the healthcare providers everywhere. Right now, as Bou said, it's not top of mind necessarily, because if you consider, what a hospital or a care facility does, it's about patients, right? I mean, it's not about IT. And that's how it should be, right? But I think you're just starting to see the cusp of a tremendous interest in the cyber criminals into this space, right? It's growing. We've seen it. We see the trends, right? Something very bad is going to happen at some point, really bad. Equivalent to, say, the loss of tons of information, or the misuse of information from a Facebook, or all of all the credit cards and financial transactions from a Target. Something like that will happen at some point. And when it does, people will really stand up and take notice. And the people who will be protected are the ones that basically got in line first and started implementing some of these more modern technologies, like stealth technology, for example, and essentially protected themselves today. It was sort of like the Three Little Pigs, right? Do you want your house made of bricks, or do you want it made of, sticks? Right? I mean, that's basically it.
Do you think this would likely be a one-off incident where one person might die and potentially it would get covered up, or do you think there could be some large-scale attack where multiple devices got hacked and over a very short period multiple people died?
It's going to be a systemic attack, is what it is, right? But it doesn't. Please understand, it doesn't necessarily have to be a hospital system per se. It could simply be medical record modifications, right? Let's say it could be dosage changes. It could be changes in medical records that now the patients are given the wrong dose, or even the wrong drugs, right? Okay, which leads to something. So you don't necessarily have to hack an instrument to make a fundamental life and death change, right? In the information, it's the information that's used. So think about this. I mean, once you lose faith in the systems that you use to dictate your clinical actions, okay, essentially all of basically the entire industry starts losing its ability to trust the system. I mean, think about what if someone went in and hacked an Epic or a Cerner system, just that system, the medical record system, didn't touch a device, didn't touch an X-ray machine or an MRI or anything like this, just touched the medical records, right? I think that's much more likely to end up causing a great grief and disruption in a much more spectacular fashion than a specific device, frankly. But I do think it's going to happen, and I think it's going to happen fairly soon. And when it does, there will be an entire change in mindset and focus in mindset of this industry on cybersecurity protection.
What do you think would be the motivation for that? Just simple hacktivism, blackmail in the end, extract some money for fixing it?
No, most of these people aren't actually doing it for money. Most of these people are doing it because it's a contest, right? I got into Fort Knox, something that they thought was impenetrable, right? Look how great a hacker I am. That's pretty much what it is, right? I mean, the money is the money is secondary.
We've talked a bit about devices. Do you think that the medical device manufacturers should be doing a lot more to secure their devices than they are doing?
So we have been talking with several of the major medical device manufacturers, and there's a greater interest in bringing security and privacy elements into their design systems, but moving that up front. So typically it's been something that's been sort of you basically build the instrument, you build the software for the instrument, and basically as the software is pretty much leaving the design phase, you do your security and privacy wrappers around it, whatever you need to do to get through regulation, right? But because of the threats, what's happening are these programs called security by design and privacy by design. Like, for example, Medtronic, which really was the great innovator that started this. They've moved that sort of privacy security gate way up front toward the beginning, where security, like our solutions, quite honestly, where security is built in by design. It's designed from the very front, and that you'll start to see that more and more, I think, as time goes on. So it's an actual change in the way that the instruments themselves, the medical devices themselves, are being designed and then manufactured.
Well, I mean, you mentioned earlier that there's this dichotomy between the devices managed by one area of healthcare and the networks are managed by IT. And I would imagine that's also true of the technology itself. The networking technology and the IT technology comes from traditional IT vendors, and the devices come from medical device manufacturers. Do you think there's an opportunity for some greater working together between those two areas to improve security?
I think it's inevitable. It will have to happen. Yes. I think you're already starting to see, like, for example, at some of the HIMSS meetings, you're already starting to see some of these partnerships be announced, right? We ourselves, are working with medical manufacturers in that ilk, right, in that way. So yes, I think that's going to be the hard. I think that is what it's going to have to be that way, because essentially what's happening is that you want the instruments that people are making now, much like say consumer goods, right? Everything's becoming, quote, smart, right? Cars, refrigerators, houses, garage doors, right? Okay, you're basically entering, the start of the smart machines or smart devices, right? Everything's connected, everything's cloud. Isn't there yet? Ultimately will be. It is going to happen, right? But at the same time, the manufacturers will have to reach out to the IT experts. These are the IT houses like ourselves, right, that have that knowledge, that longstanding knowledge, not just in terms of building security and building connections and building out the platforms and networks to support them, but that know how to do it in a way that makes sense, is efficient, is rigorous, but also is cost effective, most importantly.
Thanks very much. Well, that's, I'm afraid, is all we have time for. Thanks again, Jeff and Bou, for a very informative webinar. There's a lot of useful information there, and I hope you go and take it away and act on it, everybody who's been listening. And a reminder that this webinar will be available on demand for 12 months. That's until the 10th of May 2019 through the HIMSS Learning Centre. So from me and from everybody else, thanks very much and goodbye.
So Ashley,